Hi everyone, and welcome to the webinar module for May. We're talking about MAGI and non-MAGI medical, and we are going to do a quick introduction today, something kind of like an introductory 101 quick class. We are not going to go deep into any weeds. If I start going into weeds, I hope someone pulls me back, because we are here today to really introduce the idea of what kinds of medical programs are in the one system and talk very briefly about some of those differences and similarities. I am going to click over to the next slide, if it lets me. There we go. So we're keeping it simple today. We are talking about what is MAGI, what is non-MAGI medical, and we're going to talk about some of the differences and similarities. First off, let's talk a little bit about medical benefits in Oregon. The Oregon Health Plan, also known as OHP, is our Medicaid and Children's Health Insurance Program coverage. So different states have different names for their Medicaid. Ours is called Oregon Health Plan. Now, these medical benefits are not only coverage very similar to other medical insurance people may have, but it also may include things like long-term care services. And some of the programs also can help people pay for their Medicare costs. So it's a very large category. It has more than 40 different types of assistance that are all inclusive in the one system and in our OHP programs. And enrollment for all of these programs is always open. So there's no open enrollment period, and there is never a time when people will be unable to apply for OHP. And today we're going to talk about two different categories. And those two categories are MAGI and non-MAGI. Now, this infographic is a little funky because there are general groups of folks who are more likely to be in certain programs, but there's also a lot of details that can cause someone who maybe you wouldn't necessarily expect to be able to get a program that maybe you haven't even heard about, because as I mentioned, there are 40 plus types of assistance. But generally speaking, MAGI is going to be where you see people who are under 65, people who are not considered permanently disabled or blind. And this is what we talk about when we talk about sort of traditional Medicaid. It's based on a certain type of financial set of rules, and we'll talk more about that later. And it's on one side of this umbrella because that's generally where you're going to see the MAGI population. The other side, to the right of this umbrella, is where you're going to see more people who are over 65, people who are considered by the Social Security Administration to be permanently disabled or blind, people who have Medicare coverage. And it isn't a hard and fast rule, but it's generally going to be these two sides of the umbrella that all have the same type of coverage, but maybe different programs within. And that's inclusive of adults, it's inclusive of children. We have special programs for pregnant individual, and we also have emergency care programs. We have programs, as I mentioned, to help people pay for their Medicare. And emergency care, care for adults, children, and pregnant individuals, that really does span the whole umbrella of both MAGI and non-MAGI medical. So this is a way to try to conceptualize the fact that there are different programs, but that each individual is going to be determined based on the information we put into the application. And they may end up under this umbrella with different types of assistance. You may see different codes in systems, things like that. Let's talk more about MAGI. MAGI is an acronym that I feel like spelling it out has never made me feel like I understand it better. It is modified adjusted gross income. And modified adjusted gross income is actually an IRS term and income counting methodology that is used based on provisions in the Affordable Care Act to measure income for many of our OHP programs. So our programs are based on that modified adjusted gross income for monthly or annual income. It only looks at income, not at resources that you already have or assets that you have. And there isn't an additional requirement to have a specialized need. And now I know it feels weird to define something based on what it isn't, but this is the other side of the coin from non-MAGI. So it is an important distinction. And as I was saying, there are many ways in which an individual will be determined, and the best way to do that is to fill out a full application and have our rules engine and our workers figure out exactly which program someone fits into. But it's generally going to be for people who are younger than 65 and not blind or disabled. And you may see people who are 65 and older if they are a caretaker of a relative minor child. It has full benefits, and then it also has emergency-only benefits for non-citizens who don't have a qualifying immigration status, and that's CAWM, or Citizenship Waived Medical. So you may see people in either full OHP or CAWM under MAGI. When we're talking eligibility for MAGI Medical, we're looking at Oregon residency. Someone has to attest that they live in Oregon. Looking at household size and income, and that is a percentage of the federal poverty level that we are evaluating the household income by. And our households here are defined by relationship, tax filing, and living situation. So there are questions in the application to help get all of these pieces so that we can make the correct determination. Other things that are considered are citizenship and or immigration status. Depending on someone's age, there may be different programs and different eligibility requirements. And depending on if someone is pregnant or recently pregnant, there may be additional provisions as well. And then the last item here for MAGI is if someone has other health coverage, then for children, that can make a difference in their eligibility factors. And that's only for children being determined under the Children's Health Insurance Program, which is above that 138% of the federal poverty level. But I'm trying not to get too weedy, so I'm not going to go deeper into that today. Now, when we talk about non-MAGI medical, there are two main programs that we're usually talking about. There is the Oregon Supplemental Income Program Medical, also known as OSIP-M. And OSIP-M is full OHP benefits, just like MAGI Medical. I want to add in it also has emergency benefits, those CAWM benefits, just like MAGI as well. And then there's also another set of programs within the one system and within our non-MAGI medical bucket called Medicare Savings Programs. And those known by the acronym MSP. And we have a lot of acronyms today, so please don't hesitate to let me know if there are any that are confusing to you or we need to go over more. But MSPs help people pay for their Medicare premiums, copays, and deductibles. So it covers Medicare-related costs, and there are different programs within here that cover different levels. But it's not going to pay for things that are outside of Medicare. And we'll go a little more briefly into these two. But then, as I mentioned at the top of this training, we will have more specialized and more complete training as well on these two programs. So this is just our introduction. So we're talking about Oregon Supplemental Income Program Medical. There's something that is called a basis of need, which means that someone has to be above 65 or older. So they have to have a basis of need based on age, blindness, or permanent disability. Different OSIP-M programs have different income standards that they're evaluated on. Some of them use federal poverty level. Other ones will use the Supplemental Security Income Standard, which is a different set of numbers. Depending on how people put their household information and their demographic information, the size of the household may be counted differently, and that's because OSIP-M includes folks who are in, say, nursing care, are getting those long-term services. So there are different definitions of households, and that's going to depend on the information put into the application. There are often resource limits for this program, so that means that it isn't only about how much income someone is making this month. It also depends on if they have, say, a rental property, multiple cars, money in their bank account, things like that that are called resources or assets. And so that there are additional parts of the application that will populate if we think someone may be OSIP-M eligible, and that those dynamic sections are there so we can make the correct determination. Now, because there are more moving pieces here, it is often required to complete an interview with a state worker, and that'll be something that pens at the completion of the application, and it should give information there about how to make sure that interview is a success. We also have a separate guide that I can point you all towards to talk more about that interview and what that entails. Something that's tied to the interview is there also is a requirement for many of these programs to verify those assets or resources. So there's going to also be a step probably where someone has to sign an additional form to talk about the different assets that they have and to help connect all those dots correctly. I mentioned it in the last slide, but this does also include emergency-only benefits for those non-citizens who do not have a qualifying immigration status. So there are CALM-level benefits built into OSIP-M, just like built into the other side of OHP. I'm going to talk briefly about Medicare savings programs. This is a teaser for the more in-depth information you're going to be getting soon. But here's some important information. It's the exact same application process in one as applying for any other medical program. The short answer is that when we put things into one, the one system's going to try to give people as full benefits and as many benefits as is possible. So if someone is eligible for a Medicare savings program and also for full OHP benefits, the system will give them that. But there are also times where someone may only be eligible if they have Medicare for an MSP and not for that full OHP benefits. So people may have full benefits and a Medicare savings program and Medicare, or they may have Medicare help paying for their Medicare, and that might be the only thing they're eligible for. So these MSPs are not full benefits. It doesn't meet minimum essential coverage, but it does help people pay for their Medicare costs. It uses the federal poverty level, that FPL, for income eligibility. And many people don't know that they could be eligible for help with their Medicare. I think a lot of people don't realize that Medicare and Medicaid can be paired together and they can be dually eligible. So this is a time where, as a community partner, you can do a lot of good by letting people know that these programs exist. And if they are found eligible for them, we can offer some additional resources on how to make the most of their MSPs. And I know I'm just flying through this, but this is, once again, the teaser. We have more information for you. But just so you have a grounding in the different things within the one system, I do very quickly want to talk also about long-term care. And you might see that with the acronyms LTC, or sometimes I've also seen LTSS. So long-term care services are for people who cannot meet their daily needs of living. And so that's things like being able to eat on your own, being able to move around on your own. There's a whole list of daily needs of living, and there is an assessment to find where people live on that continuum of being able to take care of themselves versus needing help to do so. And so if their needs are assessed and they're found eligible, they can receive long-term care services. This can be paired with either MAGI or non-MAGI full OHP benefits. And if you are assessed for needing long-term care services, it can actually allow you to get OSIP-M coverage at a higher income level due to that need. It's available to children and adults. It is at this time only available to people who are on that OHP plus or full OHP level of benefits, and it is not part of a CALM or CALM Plus program. So now if someone gets approved for long-term care, and actually I do want to take one step back and say there are a couple questions on the application for medical that are specifically about being evaluated for long-term care. And it's a question that's going to be on its own page that talks about, does someone need help with daily activities of living, such as bathing, dressing, going to the bathroom, things like that. And so if someone says yes to that, then there's a follow-up question asking if someone would like to be assessed for long-term care. And that is how we know that people are interested in being considered for this program. And if approved, then ODHS pays providers to help with that person's care. And it's all dependent on the level of care or help they need. So it can include a lot of different things, and it may be in different settings. So it could be at-home care, full-time care, part-time, maybe in a skilled nursing facility. There's a whole continuum. And so we definitely are not going to cover all that today. But it's good to know that these things are built into our programs as well. So now that we've talked about the MAGI programs, the different non-MAGI programs, and all very, very high level, here are some things that we think will help you make the most of the one system and have a good understanding of enough to get people into that front door. All of the programs that I've talked about today, they're all part of the one system. They're all included in the medical application. The system will ask the questions it needs to determine eligibility. And so that happens dynamically if you're using the online system. And that means that different questions will pop up for different applicants. And that is by design. And that's to really make sure we're getting the information we need without asking a bunch of information that we don't need. And that also means it may require people to take different next steps after they complete an application. As I mentioned, sometimes there's interviews, there may be other timelines and expectations. And so that's a good thing to know. If someone has an interview, if someone has to have their assets verified, it will take a little bit longer for some of those steps to happen. And you may sometimes not get that immediate eligibility. One will evaluate for all programs and give the highest level of benefits that someone is eligible for. So it's really important to work as hard as we can to get accurate and up-to-date information into the one system. And that also includes reporting changes so that if someone's situation changes, we can evaluate for what might be a higher level of benefit, or for instance, might be those long-term care services that someone needs on top of their medical. And as I have mentioned probably ad nauseum, thank you all for being along for the ride, is that this was an introduction, and we will be talking more about non-MAGI benefits, and we have a whole module dedicated fully to long-term care services. So please join us over the next few months to learn way more than I covered today. We're trying to break it down into bite-sized pieces, and I hope that you found something today that was useful to you. And now we're going to go to questions, including that you all may be asking some great questions that we will get to in the next couple months. So if I don't answer your question today, just know that it may be coming. It's probably coming soon in an upcoming module. So you have a question, is there an income guide for non-MAGI benefits similar to the one for our MAGI benefits? And I've rephrased that a little bit. And the answer is yes and no. There is a really handy brochure for Medicare savings programs that talks about the FPL and talks about what those numbers are for someone who is on their own and someone who's part of a couple. And we can get you that brochure, and it has concrete information about income. When it comes to OSIP-M, it gets more complicated, and I haven't found a complete public-facing guide for income and resources. So most of the things that are available are they have bits and pieces, but they're not complete because it's a much more complicated method of doing income and asset counting than we use for the MAGI side. So we have partial resources, but we don't have anything that's exhaustive that's available at this time. And I see some good questions that I'm going to bring to our next teams because I don't have answers today. But let's see here. Can we do the interview on behalf of the client, or does the CP need to speak to the client to do or does the worker need to speak to the client to do the interview? Goodness, I'm fairly certain that the member themselves needs to complete that interview, but a community partner can help set that up and help make sure that call is a success. And I'm phoning a friend here because Deanna is an awesome human being who I just made an organizer because she has some of the answers. Yes. So I'm seeing confirmation that the client has to be present for the interview and has to be there. I mean, present could be on the phone, but needs to be answering the questions themselves. And I talked about that asset verification process briefly. That is something also that a community partner cannot sign on behalf of the member. They have to do that themselves. So it's important that they're on the phone. But I think that there's a lot that community partners can do to help it be a process that goes smoothly. And I see like people get really nervous about the interview. And so that is definitely something that we as community partners can help people understand. The interview is here to just make sure we have all the information we need and it's correct on the application to give the right level of benefits. And if someone needs to be then further assessed for long-term care, that's also something that a worker has to do. And it has to involve a human, not just automated systems. So it's all normal and it's part of the process. And hopefully that can also help people feel more confident about completing it. Ooh, I've talked for a while. Did that answer your question at least a little bit? Okay, awesome. All right. We have a question about Healthier Oregon and long-term care services, and this is definitely one of those where I have to say, we are in plans. There will be long-term care services at some point available to Healthier Oregon folks, but exactly how it looks and how we're making that happen is still up in the air, so I can't speak to the details. But yes, the intention is that long-term care is part of the medical coverage that people get that we are expanding with Healthier Oregon. And I definitely don't know the rules about assets that are in another country, so I'll have to look and talk to our policy experts to get answers about that. And I think we might be, okay, I see another good question, which is what phone number do we direct people to for the interview? And I am hoping one of my fellow rocks might have it handy because I'm presenting, so I don't want to poke around on my computer.
I'm looking it up right now.
Awesome, thank you. The answer is that there is a specialty line for people who have gotten that notice that says that they need an interview. So people should only be using it if they know for sure that they have an interview they need to complete. But a community partner can give that phone number, and it is different than the CP line, and it is different from the public customer support line. And we will be furnishing it to you as soon as we find it.
In fact, it is a funny phone number because it starts with 833. So that's how I always recognize that it's the correct one. And I'm going to paste it into the questions box right now. People can call that main line, 699-9075, to schedule an interview. They can also call this other 833 line directly to schedule or to conduct an interview. That is the team that can, there are expanding teams to conduct interviews, but this could be a direct line.
So it's a direct line to folks who are specially trained in completing interviews. And Deanna, do you have any knowledge of income and resources in another country? I feel like that gets complicated and I want to ask policy folks.
Yeah, my understanding is that it really has to do with what is reportable on taxes. So it all comes down to the tax rules, that if it's reportable on taxes, it needs to be reported. That is my understanding, but I'm going to try to get a verification of that.
And we also can't answer any questions today about the non-medical programs. I know that they also may have interviews. They may have other things. I am not certain. Deanna, do you know if that is the same number for other types of interviews? We may have to go hunt for that answer.
We're going to have to hunt for that. I don't feel confident there.
Just a good sign that you all are asking excellent questions. And another reason why we are committed to returning to this topic more than once. And I'm excited to have the teaser and not the weedy portion. So sorry, Deanna, but you're going to do awesome.
Right, those are all the questions I see right now, but as we're talking, people may be formulating more and just typing them in.
Yeah, thank you all for coming and participating today. I hope this was useful. We will make sure to get this content up onto group site. So as long as you have access to group site, you should be able to pull this up at a later date and we'll get the recording as well. And I think we might be actually exactly on time and ending at 11:30, which so rarely happens. Awesome. Thank you all for joining us. There will be this presentation again in Spanish at 1 p.m. today, and we'll be getting all of those recordings up as soon as we're able to. And we hope you join us next month when we talk more about non-MAGI benefits, and then the month after that where we talk more deeply about long-term care services and how to best help people navigate those different programs and possibilities for themselves. Thank you so
and we're
much.
already working, we do have actually one answer for anybody who wants to stay on, and we're working on getting answers to all the things that we could not answer, so we can certainly follow up with that. But all income and assets should be reported and will count unless specifically excluded or considered unavailable, but that's something that our system determines. And so when you look at what you're reporting, you need to report everything. Then we'll ask more questions about it, and the algorithm itself will determine what is counted and what isn't, depending on what the person is likely eligible for. But because different programs consider different income types or different asset types, you need to report them all.
And so that's even if it's foreign income, I believe. I believe there is a section in Texas that asks about foreign income.
Mm-hmm.
And
that
then
sounds familiar.
I'm also realizing that for the folks who are listening to this recording, they don't have access to our question box. So I'm going to read out loud the non-MAGI interview line so that you all have that. And that is 833-710-1020. And that is the line for completing or scheduling an interview for non-MAGI programs if someone has been pended for that interview.
Right, and we have one more answer here as well, which is that when somebody calls in to do the non-MAGI interview, they can also request benefits for the other programs.
So that includes things like SNAP and TANF.
Mm-hmm.
That is good to know. Thank you so much for hopping on and doing a bunch of legwork for me, Deanna. I really appreciate it.
My pleasure.
All right, everyone, I hope you have a great day, and we'll be back in a month with more information.